Let's talk about the etiology of portal hypertension. In addition to cirrhosis, there are other causes for portal hypertension. And these are my acknowledgements and a notice to review. And when it comes to portal pressure measurements, we have learned that we ask the help of an interventional radiologist who passes a catheter down the jugular vein, superior vena cava, right atrium, inferior vena cava, and into the hepatic vein and leave it there and measure the free hepatic vein pressure. And after taking 3 readings, then they inflate the balloon and wedge the catheter and measure the wedge hepatic venous pressure. And this actually gives us an information about the pressures in the central veins and sinusoids. And it is a way to measure sinusoidal pressure. The difference between the wedge hepatic vein pressure and free hepatic vein pressure is the hepatic vein pressure gradient. If it is more than 5 millimeters of mercury, you diagnose portal hypertension. So when you look at this pathway from the portal vein to the liver, from the portal tracts, sinusoids, central vein, hepatic veins, and IVC, blockage along this pathway can result in portal hypertension. So let us start from the post-hepatic phase. Post-hepatic portal hypertension. Classic example is related to the heart or IVC, heart failure, constrictive pericarditis, or IVC obstruction. In these cases, when you measure the pressures, the free hepatic vein pressure will be elevated because the right atrial pressure will be high, IVC pressure will be high, hepatic vein free pressure will be high. And that pressure is also transmitted down into the central veins and sinusoids. So when you wedge it, they also have wedge hepatic vein pressure elevated, and the gradient is elevated. On the other hand, when you look at intrahepatic portal hypertension, because of problems in the sinusoids, classic example is cirrhosis. As you can see here, the problem is sinusoidal hypertension. And in this case, the free hepatic vein pressure will be normal, wedge hepatic vein pressure will be elevated, and the gradient will also be elevated. So, to diagnose cirrhosis, you have to make sure that the free hepatic vein pressure is normal. And if it is elevated, you have to think, hey, the obstruction is either in the hepatic veins or in the IVC. Sometimes you can see portal hypertension with varices and everything. And when you look at it, the problem is in the portal triads. In this case, when there is portal triad involvement because of pathology, in the portal triad you have 3 things. Portal vein radical, which can be which can get into trouble in patients with schistosomiasis. You have bile duct, which can get into trouble because of primary biliary cirrhosis. You have white cells, monocytes, etc., which can get into trouble because of sarcoidosis. So when you look at the pressure measurements, the free hepatic vein pressure is normal. As you can say, hepatic veins, IVC, they're all doing good. The wedge hepatic vein pressure, the sinusoid looks good, again normal, and the gradient is normal. And in these patients, you have to document that their portal vein is patent. because the same features can be seen in portal vein thrombosis as well. So you may need to do an ultrasound to show the portal vein is patent, you have varices, but pressures are normal. That is pre-sinusoidal portal hypertension. And when you have a problem in the portal vein because of thrombosis, again, your pressures will be normal. Free hepatic vein pressure will be normal. Wedge hepatic vein pressure will be normal. Gradient would be normal. But you may see varices, and you on ultrasound or on imaging, you also notice a clot or thrombosis with or without collaterals. And that's how you diagnose portal hypertension. So key is to figure out if all the pressures are normal, portal hypertension, it is either pre-sinusoidal or portal vein. If the wedge hepatic pressure is elevated, free hepatic pressure is normal, sinusoidal hypertension. Classic example, cirrhosis. If both free and wedge pressures are elevated, then you're looking at post-sinusoidal or hepatic vein or IVC or right atrial issues. I hope this is helpful. I want to thank authors of this beautiful guideline and thank you.